If you're here, you probably already understand the cause. It's your eyelids. You've likely done the warm compress as you were told to, and you're still suffering. And you may be starting to wonder why no one walked you through what comes next. So let me pick it up exactly where the last explanation left off, because the reason your routine isn't working comes down to a single word, and once you see it, you can't unsee it. Then I'll take you up the full treatment ladder, what to do when compresses aren't enough, all the way to what we actually do in clinic. I'm Mr. Dilraj Sahota. I'm a consultant ophthalmologist here in the UK with training from Oxford University and Moorfields Eye Hospital in London. I spend my weeks operating on eyes and sitting across from people whose eyes feel exactly like yours do right now. And here's something worth saying out loud. A standard eye appointment is about 10 minutes. That's often enough to make the diagnosis, but nowhere near enough to walk you through everything that follows. So if you left with a diagnosis but not the full plan, that isn't anyone failing you, it's just the clock. This video is the longer conversation there isn't usually time for. And before we start climbing the ladder, one promise: there's a single idea more important than any individual treatment on this list. That explains why your eyes have stayed sore despite everything you've already tried. I'll come back to it right at the end because it genuinely changes how you think about this condition. And it's far more reassuring than you might expect. Here's the first problem, and it's hiding in plain sight. We tell people to use a warm compress. So that's exactly what you do. Something warm, comfortable, pleasant on tired eyes. That instinct is completely reasonable, is the word we all use. But warm doesn't melt anything. The oil in a healthy gland is runny and it flows at around normal body warmth. But when these glands get sluggish, the oil thickens from a clear liquid into something closer to a paste. And thickened oil like that doesn't begin to soften until you reach real heat, around 40 degrees Celsius, 104 Fahrenheit. And 40 degrees isn't warm, it's hot. Not scalding, not painful, never anything that hurts, but properly, deliberately hot. And the moment you aim for warm, you've already lost the temperature you actually need. So this is the simple free fix. Rung one, before you spend a single pound or dollar, stop thinking warm, start thinking hot, but safe. That one switch changes how long you heat for, how long you check it, and whether anything actually melts. Everything else is built on getting that temperature right. Now, if it's all about heat, why does the thing that everyone reaches for first let them down so badly? Picture the most common routine in the world. Run the tap hot, soak a flannel, wring it out, hold it on your closed eyes. It feels lovely for about 30 seconds. That's roughly how long it's working. Here's the honest version, because I want you to trust every word of this. A hot flannel does start at the right temperature. The trouble is it doesn't stay there. Once it's off the tap and against your skin, a wet cloth loses its heat within a minute or two. Now hold that against a second fact almost nobody mentions, the one that changes everything. The heat doesn't reach the glands instantly. It has to travel through the eyelid to where the oil actually sits. And when this was measured, it took around 6 minutes of steady heat for the inside of the eyelid to even reach that therapeutic temperature. Sit with those two numbers. Your flannel goes cold in 1 to 2 minutes. Your eyelid needs about 6 minutes of continuous heat just to arrive at the temperature in the first place. So the heat is gone long before it gets where it's needed. You could sit there for an hour with a flannel that keeps cooling. The oil deep in the gland barely warms at all, not because heat doesn't work, but because that heat never arrived. And this isn't my opinion. The international consensus on dry eye is blunt about it. In its words, not all warm compresses are equally effective. When researchers tested ordinary cloths, a single flannel struggled to lift the inside of the lid to a useful temperature, even across a full 10 minutes. The methods that did work were the ones that held their heat. So the takeaway isn't compresses are useless. Hot compresses done properly are honestly the bedrock of treating this. The international reviews call them exactly that. The problem is that a single flannel left to cool is underdosing you. That's why so many people conclude quite reasonably that the warm compress eyelid thing didn't really work for me. 2 honest fixes: constantly reheat that flannel so it never leaves the range, which most people won't keep up, or use something built to hold the heat. So here's the upgrade, and it costs less than a couple of coffees. Instead of a flannel that cools in a minute, use a microwavable heat mask. The kind that holds a steady, safe heat for around 10 minutes. That's the whole point of it. It stays in the range where the oil melts, long enough that the heat travels through the lid and finally reaches the glands. A few rules, because the device alone isn't the magic. 1. Get it honestly hot and check it every time. Warm it as directed, then test it on the inside of your wrist first. Clearly hot, but never anywhere near painful. Your eyelid skin is thin and it has a limit, so if it's uncomfortable, let it cool. Hot but safe, never painful. 2. Give it real time. A brief hold won't do it, for exactly the reason we covered. Around 10 minutes is the usual advice, and I'll be straight with you, the research hasn't actually pinned down the perfect number of minutes. Even the international consensus admits we don't have that nailed. So don't fixate on a stopwatch. What matters is sustained heat. Longer and steadier beats short and hot then cold. 3. The steps almost everyone skips. Heat is only half of it. Heat melts the oil, it doesn't move it. Once the glands are warm, that softened oil needs a gentle nudge to come out, which is why the consensus is a hot compress works best, followed by a gentle lid massage. So straight after the heat, a light, careful massage along the lids, always towards the lashes, never touch the eye, heat, then express. Heat without expression is not quite as effective. 4. Twice a day, and consistency beats intensity. Glands sluggish for months don't reopen in a day. Like brushing your teeth. Twice a day while things settle, then a maintenance version so they don't clog again. Do this properly for a few weeks. Many people turn a real corner, but not everyone does. And if that's you doing the heat, the time, the massage, and still gritty and sore, you are exactly who the rest of this is for. Heat is rung 1 of a ladder. Let me take you up it. When nothing's working, it's the most natural thing in the world to start looking further afield at diet, at supplements, things you read online. Some of it is well-meaning, a lot of it isn't backed by good evidence. I'm not going to send you down those roads. The one exception worth a word is omega-3 fish oil. The evidence there is genuinely mixed, but it isn't nonsense. For some people it seems to nudge the oil quality in the right direction. If you'd like to try it, that's reasonable, just don't expect it to do the heavy lifting on its own. Because here's what is supported, and it's not just my view, there's an international consensus on dry eye, refreshed in 2025, called the TFOS Dews Report, and it lays out exactly what I'm about to show you. Not a random list of remedies, but a ladder. You match the treatment to what's actually driving your dry eye, and you step it up when things that are simple aren't enough. That's the real answer to why isn't it working? Most people never get past the first rung. Rung 2, lid hygiene. Keeping the lid margins clean matters because these glands sit right where debris and bacteria collect. That can mean a dedicated lid cleaning routine rather than just water or saline. And for some people, part of the problem is actually a tiny mite that lives at the base of the lashes. There's a specific sign we look for and a specific way to treat it. I won't go deep here because I've made a whole separate video on lid margin disease, blepharitis, and exactly how to treat it. I'll point you to it at the end, because for some of you, that's the missing piece. Rung 3, the right drops, and why the wrong ones can make it worse. Most people reach for whatever's on the shelf, but if you're using drops many times a day, the preservative in a lot of standard bottles can, over time, irritate a surface that's already inflamed. So when drops are used frequently, we usually move people to preservative-free ones, the single dose vials or specially designed bottles. Same soothing effect, without the ingredient that can quietly keep an angry surface angry, which is the preservative. Quick aside, if this is useful, do subscribe. I work through exactly these questions regularly. And remember that one idea I promised at the start, the one more important than any single treatment. We're almost there, hold on for it, because once you see it, everything we've just climbed through suddenly makes sense. Now, everything up to here, you can largely do yourself. From here up, we're into territory that needs a clinician, and I want you to know it exists because that is exactly what the 10-minute appointment rarely has time to explain. When the surface stays inflamed, despite good home care, A specialist has options you can't buy over a counter, and I want to demystify them, not prescribe them. The first one is prescription drops that calm inflammation. If your eyes have tipped into a cycle where the surface is genuinely inflamed, a specialist may consider an anti-inflammatory drop. Cyclosporin is the one you'll most often hear about, and there's a newer alternative in the same family called Lifitegrast. These aren't quick fixes. They work over weeks to months, quietly changing the environment on the ocular surface so it can settle. Prescription only for good reason, and they need following up. But for the right person, they can be what finally breaks that cycle. And when things are really flaring, a specialist might add a short, closely watched course of a steroid drop, just to break the inflammation quickly, before stepping back down to something gentler. That's very much a short-term supervised tool because steroids can have serious side effects. The steroids need monitoring. They're not something to seek out yourself. There's also a group of antibiotics used here in an unusual way, not really to fight infection, but for a separate anti-inflammatory effect on the glands. That might be a low dose of an oral tablet like doxycycline, particularly for people who have a tendency for facial redness or rosacea. Or, and many people haven't heard this, the same kind of benefit can often be delivered as a drop, rather than a tablet, using topical azithromycin, giving comparable results without the whole body side effects of an antibiotic by mouth. Which one suits you is entirely a decision for the clinician who's examined you. I'm telling you they exist so that if one is offered, you understand why. If you've been stuck on just do warm compresses for months with nobody mentioning a ladder above it, it's easier to assume that you've run out of options. You haven't. You've reached the top of the rungs that you can climb alone, and there are more. At the very top are the treatments we do for you in clinic. And these are exactly the ones the international consensus names for stubborn gland disease when home care isn't enough. The first takes everything we've talked about, real heat held at the right temperature, then gentle pressure to clear the glands, and does it with a device that controls all of it more reliably than you could at home. It warms the glands from the inner surface of the lids and expresses them at the same time in a single thermal pulsation treatment of around 12 minutes. And the evidence is genuinely striking. In randomized trials, that one 12-minute session improved how the glands work, with the benefit lasting around 3 months, comparable to doing warm compresses properly every day for those whole 3 months. One session standing in for months of effort. That's the treatment I offer for my patients in my clinic in Birmingham. The second is a light-based treatment, intense pulsed light, IPL, applied to the skin, across the cheeks and around the eyes. It works on the inflammation driving the whole problem, usually over a short course of 3 or 4 sessions. And for the right patient, it settles things that heat alone never quite does. I won't oversell either, but for people who've done everything right at home and still suffer, these are often the step that turn things around. And hardly anyone knows they exist because the standard appointment usually doesn't get that far. Let me be as straight with you as I'd be in clinic, because a video that only tells you what to do and never what not to expect isn't being honest. First, this ladder is for the very common evaporative type of dry eye, the eyelid and oil problem you already know you have. But not every dry, gritty, watery eye is that. Sometimes the tears themselves are lacking, sometimes what feels like dryness is actually an allergy, a side effect of a medication, or part of a wider condition affecting the whole body. So if you climb this entire ladder carefully and get nowhere, that isn't failure, it's a clue. It means that the problem may not be the one this video is about. It's worth being properly assessed rather than climbing the same ladder harder. Second, who this won't transform. If your glands have been blocked and neglected for many years, some may have unfortunately quietly wasted away, and no amount of heat brings back a gland that's already gone. That doesn't mean you're beyond help. Protecting and clearing the glands you still have is absolutely worth it. But the honest goal becomes comfortable and stable, not perfect. Realistic expectations are part of the treatment. And one important line to draw: everyday dry eye is miserable, but it isn't an emergency, and it's safe to work through this ladder. What is different is a red, genuinely painful eye, not gritty and sore and irritable, properly painful, especially with real sensitivity to light or a sudden drop in vision. That combination is not usually ocular surface dry eye. It's not something to sit at home treating with a heat mask. It can point to inflammation inside the eye, a problem with the eye's pressure, or an ulcer on the surface. Those need seeing quickly. If that's you, this video isn't the answer. Contact your GP, call 111 or go to an urgent eye service. I said at the start, there's one idea that matters more than any single treatment on this list. Here it is. And it's the thing that finally makes all of this click. For a long time, we thought of dry eye as simply blocked gland. Unblock them, job done. Now we understand it's really a cycle, and that is now the backbone of how the international consensus approaches this whole condition. The blocked glands inflame the surface of the eye, and that inflammation in turn makes the glands work even less well, which inflames the surface even more. Round and round. That's why one fix done once so often disappoints. You clear the glands, but the inflammation is still turning the wheel, so the eye stays sore, and you conclude nothing worked. Now here's why I wanted to leave you with this, because it's genuinely good news. Once you see it as a cycle, everything changes. You can stop searching for the single magic cure that was never coming, the one the internet keeps promising you, and you start doing something far more achievable, gently taking the heat out of that cycle from a few directions at once. That is exactly what this ladder does. The heat and the clearing settle the glands, the right drops, and where they're needed, the anti-inflammatory treatments settle the inflammation. Break the loop in 2 or 3 places at the same time, keep it broken with a little maintenance, and the wheel slows and stops. The people who understand this are the ones who get comfortable and stay comfortable. They're not chasing a cure. They're quietly keeping a calm eye calm. And that, unlike a cure, is very, very doable. If you had to explain this to your family at the kitchen table tonight, here it is in 2 sentences. Dry eye like this isn't usually one broken thing to cure. It's a cycle of blocked oil glands and an irritated surface feeding each other, and warm cloths alone rarely break it. The fix is real, sustained heat, plus, when needed, treatments that calm the inflammation, done together and kept up gently. And once you treat it as a cycle, rather than chasing a single cure, it becomes genuinely manageable. And for a lot of you, the missing rung is the lids themselves, blepharitis, sitting right alongside all of this. I've made a full video on exactly how to treat it when nothing else has. And if you've been going around in circles, that's very likely your next step. It's on screen now. Look after those eyes. I'll see you in the next one.